assays.
Thank you.
I think another question that does come up is we use tamoxifen for prevention of developing an invasive breast cancer in people who have high-risk lesions. So for example, people have atypical ductal hyperplasia, lobular carcinoma in situ, or ductal carcinoma in situ. And this means we give people tamoxifen for 5 years, and it does have some side effects: hot flashes, night sweats, risk of endometrial cancer, risk of blood clot. And so there's always been a question about, is that the optimal dose? Could we give a lower dose of tamoxifen, and would it be effective at preventing breast cancer events? And so this study, they were looking at what they call baby TAM, so low dose tamoxifen, where they gave this low dose, which is 5 milligrams. A typical dose is 20 milligrams. So this is much lower. And they took patients who had these high risk lesions, not people with invasive breast cancer. I want to make that very clear, that this was only for people who had ADH, LCIS, or DCIS, not invasive breast cancer. And they randomized them to get 5 milligrams of tamoxifen or placebo. So they are not comparing the two doses. This is not comparing 5 milligrams to 20 milligrams. It's just saying, if you gave nothing, how would it do compared to 5 milligrams? Does a low dose do better than nothing? And here the study did show that it did well. It prevented breast cancer events by about half, which is important. And certainly, if you look retrospectively at other studies that have looked at tamoxifen at the full dose in this setting, it's pretty similar in terms of its efficacy. Again, not a head-to-head comparison. And when you looked at the side effects, they were a little bit less. They still had some hot flashes. It was generally less. The rate of endometrial cancer compared to historical control, less. There still was one endometrial cancer event. There still was a DVT event, but again, less than what we would typically see. So, I will say this isn't conclusive data in my mind. Again, it's not head-to-head comparison. But I think what it does mean is if someone has DCIS, for example, and they're not tolerating the 20 milligram dose, I would feel comfortable telling them to take 5 milligrams. It is a little hard to take 5 milligrams though, because the tablets come in 10 milligrams or 20 milligrams. So you have to take a 10 milligram tablet and cut it in half. Some people have argued you could maybe take 10 milligrams every other day. But again, do not take this away to say we could do this for invasive breast cancer. We have no data about the efficacy of doing that, and we would not recommend